Hi, Dr. Rowley. So I'm teaching a class in research, and I just want some feedback and, maybe just to motivate my students. So can you start by introducing yourself?
Sure. Hi, everyone. My name is Dr. Rowley. I'm a radiation oncologist here at Maimonides. I just finished my training at Maimonides. I went to medical school at SUNY Downstate. So I've been in Brooklyn for about 10 years.
And how many research articles do you think you've published?
I probably have 20, maybe 20. Or so.
Okay. So I just have a few questions for my students. What is the best way to get involved with research personally if you aren't already?
So, you got to find a mentor or someone to help you out with it, and you want to find a project that you find interesting or a question that you like and the work you like. I don't think it's a good idea I find a lot of people who are doing research for the sake of doing research. You should do research because it's a question that you find interesting to you. Either at your school, I'm sure there's people involved in research, or at any medical school or most sort of academic radiation oncology departments. There's various research projects depending on things that you want to be involved in. But in your day-to-day, you discover like some sort of problem and you want to try to address it or look to see if other people have this problem. Usually people are always looking for someone to help get involved in research and data collection or stuff like that. So just contact really any radiation department at a medical school. It shouldn't be too hard.
Okay, thank you. Besides radiation oncologists, who do you think is the coolest part of the radiation oncology team?
You're definitely going to get me in trouble with that. What I really like about radiation oncology is there's so many different disciplines involved in the care. Even from a oncology perspective, we have medical oncologists involved, we have radiologists involved, we have pathologists involved, we have surgeons involved, we have radiation oncologists, and then within the radiation oncology department, there are so many specialties. We have nursing, we've got admin, we've got therapists, physics, dosimetry, so it's pretty multidisciplinary. I think that therapists are working with the patients every day, so they're spending the most amount of time with patients. So I think that's sort of a special interaction. I think the therapy team spends more time with any of the patients than even I do. So, I appreciate the work there.
Okay, good answer. And last question. For a while, other medical professions have told me that radiation therapy is a dying field and is going to be replaced within the decade. And others have told me that it's here to stay. What is your honest opinion on the matter?
No one knows for sure. I would imagine the radiation is here to stay. I think the way we use radiation is going to change and continue to change. There are massive increases in terms of systemic therapy with immunotherapy. People are living a lot longer. And so if people live longer with cancer, there's more indications for treating them, especially with SBRT. So patients that have oligometastatic cancer, so they just have a metastatic cancer to a small number of sites. We're using radiation a lot more. In the past, we weren't using that. I don't think that there's going to be a magic pill that'll just erase all cancer. That would, honestly be the ideal situation, but maybe that'll happen in a small number of diseases. But I think that as people live longer, they're more likely to get cancer, and as they get more cancer, they get more treatment, and 50% of people diagnosed with cancer ended up getting treated with radiation. So I think it's a specialty to stay. The amount of time that people get radiation for is probably going to continue to shrink. So people probably aren't going to get radiation for 9 weeks anymore. It's probably going to be more like 3 weeks or less. And I think that'll continue to change. But I think that the field is here to stay for sure.
Okay, and last question. I have a personal question. When you're making your own research paper and you're formatting and you're collaborating with so many different people, what do you feel is the number one piece of advice you have for people writing their papers and trying to collaborate with other members?
I think it's important to establish roles and sort of expectations of who's going to do what. Usually one person takes responsibility for writing or a majority of the writing. An easy thing to do is to put it into Google Docs and allow people to share it so you can give comments. I do find the more people you get involved, the more opinions you get, the more difficulty it is to get the words out, because it's like, oh, I want this and someone else wants this. So it's like more opinions isn't necessarily better. But I think that kind of expectations of who's going to do what and how it's going to work before you start helps a lot. And then you got to be able to move, be a little bit nimble, because as you collect data or as you do analysis, things change. But usually you want to have sort of two main people involved. One is usually like sort of the first author that's sort of driving the project, and then usually there's like a senior author that's sort of like kind of guiding it, and then you kind of go from there. So I don't know. I think everything's different, but that's my general advice.
Okay. Thank you, Dr. Rowley.
No problem.